All right. So many congratulations. And you know, today we want to hear your expressions. I mean, now you have got the MRCP diploma, and mashallah, you have passed from Bangalore. So today we want to hear from you about your experience with us and how you felt about the overall exam. So how are you feeling now? I mean, big news in Ramadan, a blessed month.
Really, really, just after finishing my iftar with my families, I got your message that result is released. I was shaking to open my actual cell phone and what's going on, and I was sweating at the time that what happened. So I just look and have a bit just cloudy that I want to confirm with my brothers that what he have written that and my brother told me street and pass is here. So uh, I I pray for Allah and thanks to Allah for everything. And at the same time I want to say thanks all of my colleagues and teachers who helped me in my journey. Actually, it's really a tough journey after the corona outbreak. Actually, it's very really tough. So I feel released a bit that Allah listens our prayer, and hopefully all of you who are trying for MRCP, inshallah, will come success in one day in right time. So thank you everything, sir. Actually, you did lots for us, and you are doing hard for us for lots, and you are giving more time as you we need. So that's all I want to say about my expression actually.
All right. So, I mean, it's a tremendous moment, actually. I mean, you realize after some time, I mean, the next day you wake up, you find yourself, okay, now I was pursuing one exam and today it's over. So I was to pursue next. And you have done it. I mean, you have got the MRCP diploma. I mean, that's also one end of a journey and the beginning of another one. Okay, like there are more exams to go. I mean, the exams never end, but it's really wonderful, when we find the news of our candidates doing great. And Dr. Noor has worked very hard, mashallah, and we were praying that we have more successful results ahead. And like we have good results, there are also failure stories as well, though we learn from those failures. I also talk with the candidates who can't make it to see what exactly went wrong. Similarly, when we go on or talk with candidates who have passed, okay, they also have had to struggle. I mean, this is not very easy to pass from this center, especially international one. So just Dr. Noor, I'll just recall back about this
Okay.
center. I mean, I wish to know about one of the clinical stations that many of the candidates were talking about in terms of Bangalore, especially the neuro station. I mean, today, once the results were out, many candidates approached me and they were talking about the neuro station that was quite difficult for many, and also the respiratory. So I would just want you to shed some light. I mean, what exactly happened in this neuro station and alongside the respiratory station? That how was it? And what are the problems and what did you find? If you could give us just a few minutes of yourself describing.
Actually, it was my first stations when I entered into the neuro and cardio stations. The first case was in the cardio, and I was not traveling about the cardio stations. I first on the first instant I heard a click sound from the outside. So I think it is the valvular heart disease. So I didn't any feel difficulty in the case session. But in case of neuro station, when I come back, actually the young lady actually. So the flavor of young lady in neuro stations, we always thought is an MS. So the instruction was given to me that examine the ladies, young ladies, and do the relevant. That was the instruction, my instructions. So at another instruction was given, he cannot work for a few months. That was my instructions. So at fund assistant, I do expose from the beginnings, and I started according to the greetings, introductions, greetings, and postures and pain and positions. I started in that way. So at that time, I asked the young lady, "Can you able to work for me?" She said that she cannot at all work for me. So at the time, I asked that, "Can you raise your legs from bed?" Okay, and she cannot, just totally paralyzed. Then
Okay.
I assess the uh, tone, power, reflex, and then I started this way. It's very, very obese. So it is very tough for me to see raise the tone. The tone was going down both sides, and the power is zero at most. And I got the reflex a bit slow down, but not absent. But I do the reinforcements by the hands. He can do the reinforcement by the hands. When I got the reinforcement in the hands, I exclude that it is not a GBS. So in the hands, power is okay, but the reflex is just slow down there. By reinforcement, the reflex was present. So I was confused at the time. I was good. But when I go for the coordination test, he just a bit raised the hand, legs, but it cannot move properly. And then I go for,
I mean, you couldn't check the coordination because the patient had weakness.
yes, exactly. So, but when I was put the legs over the knees by myself, he cannot. She cannot. So and then I was checked for the directly going for the, because I was losing my time. So I want to see the sensory level from the beginning. So when I see the cotton, examiner told me don't see about the cotton. So I omit it. Then I asked for the pinprick directly. So I got the sensory levels about around up to the around the T10, below the T10s exactly. Then examiner asked me, "Don't more examine the patients. So tell me what is your findings." So I said the findings. According to he cannot work. The tone, power, reflex, the sensory level is there. So he asked me what is the lesions. Unfortunately I said this is the lesion in the peripheral nerve, but I should say about the spinal cord. So
Okay.
then I will correct myself that it is in the central nervous systems. So if I asked you, she has the weakness is 2/5 and she has cerebellar sign. So what is your diagnosis? I said that it is multiple sclerosis. So if you examine the upper limb, do one examinations in the upper limb, what will you do? Then I will say I want to examine the cerebellar signs. Then examiner asks me, tell me one investigation. Then one asks me about investigation, the bell is ring. I cannot say anything. That's my actually history of neurostation. So I was afraid of the losing my welfare and the management plan. So I was thinking I was failed, but fortunately they give me 16 out of 20.
I mean, in
That is
this,
my,
I've seen feedback of 4 other candidates today. Some, I mean, not in my course, but they approached me with this feedback. And what I realized, many did bad in the neurostation and respiratory as well. I do not know what went wrong in the respiratory as well. So from what we gather from, if we summarize, we found a lady who had almost 1/5 or 2/5 power and couldn't lift up the leg. And the tone was, according to you, it was flaccid, was it? Or the
right.
tone was flaccid. Okay. The tone was flaccid, reflexes were diminished, but you noticed that on doing, like, you ask the patient to do some maneuvers, right? And you just
Right.
reinforcement, you did that, and that patient,
Right.
while doing that, you noticed the jaws were, I
Was
mean,
there little bit low,
both the
and
jaws, I
plantar
mean, knee
was,
and ankle, both of them.
both of them is a bit very low. It's not absent, and there's a low plantar extensor. But
I'm,
I was
I'm,
confused that
Mhm.
it could be the transverse myelitis or not. but I said directly it could be the M. Examiner asked me if there is cerebellar sign, what will be differential diagnosis? At that time I say it can be my multiple sclerosis related to the transverse myelitis or not. I'm not sure about that. That is my answer actually at the time.
Okay. And you're sure you found a sensory level?
Yes, sir. That was sensory level, is no doubt. But
Okay.
with that sensory level, I would expect the catheter, but there is no catheter is there. So it was very fortunate that there is no catheter is there.
Okay. I mean, sometimes it's like if the patient has dual pathology, I mean, it can all be explained with dual pathology. If the patient also has diabetes alongside, let's say, then perhaps the peripheral nerve, I mean, you might get a bit of peripheral neuropathy there alongside with apomotor signs, or patient who is in spinal shock. But everything will change according to the plantar.
Right.
The plantar was not flexor, according to you.
Right. It was not extensor exactly. It is just equivocal, I must say, because I tried twice. So I was time there because of plantar. I was confused. Sensory level is there, but I am confused. I'm trying to elicit about the plantar extensor. I would say spinal cord compression, but I cannot find it out actually, sir.
Okay.
But they asked me about the differential diagnosis. I said this could be the MS if cerebellar sign is there, and another differential diagnosis subacute combined degenerations. So, and if you said upper limb examination, what will you do? I say I will see the cerebellar sign and eye examinations. That's all.
Okay.
All
right. So from whatever the feedbacks that we gathered, I mean, many were convinced the patient has or has had the cerebral signs, and most of them said yes, there was sensory impairment. And one or two candidates also mentioned like there was a sensory level and the jobs were absent. That's what didn't go at the initial point. So the first day it happened when I received some feedbacks, I gathered that it might be a case of transverse myelitis and patient might be in some kind of spinal shock perhaps. But that doesn't explain the cerebellar signs. So if you bring in cerebellar signs, yes, you have to think about MS, and sometimes with MS you can have transverse myelitis as well. It was indeed a difficult case. All right, and
really, sir.
what just a bit about the respiratory station.
In the respiration, I actually got the poor marks, 8 to 820 out of 20, because I at the end when I was going to see the leg edema, patients say actually, but I bit apologize for it. I'm not sure, but it was a case of I told this is a case of interstitial lung disease and the bronchial asthma along with that. Young middle-aged woman has no sign on the peripherally, but there is a signs of wheeze is there and bilateral crepitation I found, but there is no clubbing, no respiratory failure, and now connective tissue disease is there. And in the periphery, there is no evidence of respiratory failure. Only I found there is a wheeze is there and bilaterally fine in respiratory crackles. But my fault was there. The middle-aged woman said, "Oh, on checking the," but I'm not sure why this.
That would be like costing the welfare. Welfare, you got full mark. It's not about that particularly. Young female with wheeze and inspiratory crackles. Okay. Any deformities in the hand, anything you noticed that the patient had alongside?
Nothing was there actually.
All right. Okay. All right. So because not only you have seen many scoring poorly in this respiratory station, so that kind of raised curiosity, and many of my candidates got seat in Bangalore as well this time. So let's see. Okay. And again, I'm going to thank you. Thank you for your time that you've joined us, and it's time for you to celebrate. And it's a great gift that you've given us in the month of Ramadan. We are really happy, okay, for your success. And also to Dr. Shumon, perhaps he has a poor network today and he's not joining us, okay. You would have loved to, and we would have loved to congratulate him up front, okay. And thanks to many of you who have joined, okay. So thank you, Dr. Noor, and please remember us in your prayers.
Thank you, sir, for your everything. Actually, just keep continuing to learning for the candidate was examining, and Allah give you supports and pray for you, sir.
Thank you, thank you. And just to say, Dr. Noor has, I mean, did really well in the station 4. He scored full marks there, and that's great. Okay, and that was what I was worried about most, and you pulled it off. I mean, that's a massive thing to do. Okay.
Really, sir. Actually, I was very much afraid of station 4. And what I must say, you always say about the examiner that before the examinations, 7 days back, no hurry to the hospitals for seeing the patients, just uh, without any books, just thinking and rehearsal by yourselves, and before going for examination, actually, in the exam day.
I mean, that's what should be the practice, because I mean, that's what's proven, and that has helped most of the candidates. And I ask all the candidates who are in my course or not, don't exhaust your brain before your exam. Okay. So don't exhaust your brain before your exam. It's like I have set several examples for it. For instance, you have to take a large meal someday, and before that day, you enter a buffet and you full your meal, like full your stomach with all the things you can grab. So the next day you won't be able to eat at all. That's what happens. Like just candidates before the exam, they rush into the hospital like they're going to learn everything within a week. And they keep that way. I mean, most of my candidates in Middle East, I do not know, they have had the wrong impression sometimes that I am going to take a break for 7 days. I'm going to go into a clinical course. Even it happened in UK. One of the candidates, what he did, he just did one of the courses and it ended before the exam, before the day of his exam, and that brought disaster. Okay, so I mean, keeping yourself calm and cool in this exam before you take it is also an important part of your preparation. Is how you prepare for the exam. It's part of the preparation. Okay, thank you, anyways, doctor. Okay, thank you, anyways, and
Thank,
again, many prayers for you. We are very happy.
thank you, sir.
All right.
Allah Hafiz, sir.
Allah Hafiz, doctor. في أمان الله.